Okay, first question. Do you have a protocol for fibromyalgia? Um, uh, no, I don't. So, and the reason why I don't, because there's reasons why a person would have the symptoms of fibromyalgia. Fibromyalgia is not a disease in itself. Fibromyalgia is a collection of symptoms. It's a syndrome. So you have to figure out why a person has this collection of symptoms. Do they have an autoimmune issue? So they have antibodies to self tissue. Very common. They can have antibodies to collagen. They have antibodies to their upper motor neuron brain issues. So running labs that will look for antibodies to self tissue would be in order. Also, with fibromyalgia, you could have some sort of chronic infection, chronic Lyme type issue can be an issue with fibromyalgia. So you don't want to, and I'd recommend this with just about everything. You don't want to go to somebody who's just gonna here's my fibromyalgia protocol, or here's this protocol for this disease. Um, I'm not saying somebody might not be helped by that, but you know you have to get to the reason why. You always got to dig to the reason why and try to figure that out, and then treat the reason why, not treating the named disorder or named syndrome or named disease. Um, Unfortunately, that is really what is happening in the practice of medicine now. I mean, everybody's just a disease. So the idea in medicine is we come to the name of the disease, and then we look up in Merck Manual now electronically, and we give this drug for that disease. Well, is it treating the reason why the disease is there? No, it's not typically treating why the disease is there. It's not addressing the reason why. Well, are you helping the patient? Well, the drug may effectively decrease that person's symptoms, but just because you've decreased the person's symptoms doesn't mean that you've effectively helped that person with overall morbidity and um, issues with mortality from that disease. I don't know. I think it's best to look and try to dig in to figure out the reason why. Next question. What are supplements to support the mitochondria? What are vitamins that help Lyme disease? Oh, this is a multi-question here, so I don't typically read these questions before I get them in. What are the best probiotics for someone with reoccurring vaginal infections or UTI or both? What's the best cellular detox supplements? Oh, 4 questions in one. So first of all, best questions to support the mitochondria, best supplements to support the mitochondria. Um, Again, if a person has mitochondrial issues, so they may have, so what does the mitochondria do? The mitochondria is really responsible for making energy for the body. So in the mitochondria, you create um, ATP. So ATP is energy that is needed for that cell, that is needed for the body. So if the mitochondria has dysfunction, and there's a lot of books out there that talk about different diseases are mitochondrial diseases. Cancer is a metabolic disease, talks about dysfunction in the mitochondria. So um, chronic fatigue, people point to, well, it's the mitochondria. You're not making enough energy. But even with that, you've got to figure out why. So before we start just throwing supplements, this is going to help mitochondrial function. Um, so we're going to support it with this supplement. You have to find out why you have, if you truly do have mitochondrial dysfunction, and then why you have mitochondrial dysfunction, and solve that. There's many reasons why a person can have mitochondrial dysfunction, and one can be toxins, one heavy metals, all sorts of things that can interrupt mitochondrial's ability to make energy. But it's much bigger than that. A person can have energy issues that aren't tied to mitochondrial function at all. They're tied to anemia. They have energy issues that are tied to um, chronic inflammation. You can have energy issues that are tied to um, hypothyroidism. You could have energy issues that are tied to a lot of different things. So it's again digging to the reason why. I don't want to disappoint everybody, but I'm not going to be a doctor that's just going to say, just take this for this symptom, because you're not finding out why. So you got to dig to that. And there's some labs that you could do to figure that out. I'm going to hound this on the Holistic Health Hour about digging to the reason why, because it is so important to really achieve ultimate success in anything you're doing. If you go look at our website, connorsclinic.com, you can go up on the upper tab where it says courses. Our best course to take for these overall health issues is the chronic disease and autoimmune course, where I go into great depth through that course on why you should run certain labs, why you should do certain tests to figure out, and what you would find on that test, and what you would look for on that test, how you would best interpret that test to find out the reasons why I have an issue. So that chronic disease and autoimmune course is going to be your best thing to do to look at that. Even if you're working with a functional medicine doctor now, and maybe he or she doesn't have as much time clinically to explain the result. Maybe you're running some of these labs. Maybe they don't have the time to explain these labs in great detail to you. Well, I created videos on that course, so I did it so that my patients, I could just say, go to module 2 of the chronic disease course. I know you're on that. Watch some of the labs on blah blah blah, or watch some of the videos on this subject, because then that saves me time with you not being charged per my time to explain this to you, when you could go watch a 12-minute video and explain it to you, and then you can watch it 2 times if you need to. So that's the thing to do. Next part of this question: what are vitamins that help Lyme disease? Again, there's really 3 stages of Lyme disease. So if a person is in stage 1 is defined by the fact that you person just got the tick bite. So you're just infected with an acute bacterial infection. Borrelia burgdorferi is the bacteria in Lyme disease. And I know there's multiple different bacteria and viruses that are co-infections that go along with Lyme disease. But so when I say Lyme disease, I'm talking about Burgdorferi and the multiple co-infections. So a person just gets Lyme disease. You cannot kill the viral component, except through your own immune system function, but you can kill the bacterial component when it's still in the blood, still in the tissues, and it has not yet traversed to go inside of a cell. So if it's still in the tissues, still in the blood, you can kill the bacterial component of Lyme disease with an antibiotic. So I always recommend that if you have acute Lyme disease, which I call stage 1 Lyme disease, you use an antibiotic. You use antibiotic therapy to kill it. That's going to be your best bet. Problem is that many times you won't catch it when it's still in phase 1. Again, phase 1 is defined as the bacteria has not yet gone intracellular, inside of a cell. You might just have the symptoms of Lyme disease, which are like flu-like symptoms, and you go to a doctor, you say, hey, I was outside, I got bit by a tick. Maybe you did, maybe you didn't find the tick on your body member. It's a deer tick, not just a regular wood tick. And you maybe had a bullseye rash, maybe didn't have a bullseye rash. Regardless, you may end up with a doctor who won't prescribe an antibiotic without getting a Lyme blood test, which I think is foolishness. Find a different doctor that will prescribe based upon symptoms, based upon signs, other than labs. The reason is if you get the blood test and you wait a week to get that blood test back, it may have already progressed into phase 2, meaning that the bacteria has gone intracellular. So as long as you have one bacteria that goes inside the cell, you have a chance of not being able to kill it all through using an antibiotic. If you catch it truly in phase 1 and you use an antibiotic, 9 times out of 10, you're going to be able to knock it out of your system. And you're not going to be worried about taking vitamins for it because you killed it with an antibiotic. Now, taking other vitamins and nutrition that will stimulate an immune response at that point are beneficial because of the viral component. So we have a product called Acute LX, which I created specifically for that acute phase Lyme. But that isn't a substitute for an antibiotic. So I still recommend that you get an antibiotic in that situation. If you go to a doctor that says we need to get a blood test before I could give you an antibiotic, go to another doctor immediately. Try to get an antibiotic for that situation because you may miss it once it goes into phase 2. Once a bacteria goes intracellularly, then it can start reproducing inside the cell and create a chronic disorder. So once it's in a chronic disorder, then it's more difficult to kill it with an antibiotic because antibiotics don't go intracellularly, and it won't kill the bacteria when it's inside the cell. So it will replicate inside the cell and then come outside the cell membrane again and go into the tissue. That's when antibiotics can work. That's where long-term antibiotic use can be beneficial for those with chronic Lyme disease, phase 2 Lyme disease. The problem is long-term antibiotic use wreaks havoc on the rest of the body in your gut system, etc. Then there's also a phase 3 Lyme disease where your body has now made antibodies against self-tissue. Because this bacteria is continuing going inside and outside the cell, your immune system is trying to kill it, and then your B cell response of your immune system can then create antibodies against self-tissue. So you now have antibodies against self-tissue. You now have an autoimmune disease. Chronic infections like Lyme, chronic infections like Epstein-Barr, and things like that are known to be a major trigger to stimulate an autoimmune disease, to something that a trigger to an autoimmune disease is something that the immune system is unable to kill for various reasons, and then it creates antibodies to self-tissue where it's found that bacteria, and now you have antibodies to your own cells. That's the definition of an autoimmune disease. Once you have autoimmune disease, phase 3 Lyme, or an autoimmune disease of any kind whatsoever, so you have antibodies to self-tissue and you have no idea what caused it, that you're in a whole other game. You absolutely need to get that chronic disease and autoimmune course, because you should not be taking any immune stimulants, long-term immune stimulants, if you have self-antibodies. That goes for if I have Hashimoto's, well, that's antibodies to the thyroid gland. You should not be taking long-term immune stimulants. You should only use immune stimulants in acute phase reactions. So, lot to know there. I spoke quickly, but that's all in our Lyme course and our autoimmune course. What are the best probiotics for someone with reoccurring vaginal tract infections, UTI infections? What are the best probiotics? Well, I always suggest that you alternate probiotics. I know there's more and more science coming out about specific probiotics for specific issues and specific biomes of your body, microbiomes of your body. However, I think it's best to alternate probiotics. I also think that you're not going to cure your problem by taking probiotics. So it's not so much a probiotic deficiency, meaning I'm one type of probiotic short of solving my problem. Where you get the amount of probiotics that you get in a capsule of probiotics compared to what you get in your food in a variety of different foods is not even comparable. So it's really more so what you're eating. If I'm getting chronic, recurrent UTIs, you need to dig a little deeper to figure out the why. So there can be different triggers, different food sensitivities, different chemical sensitivities that are causing these things. Hormone disruptors can cause these things too. So you need to dig to why. While this is a good and valid question, I don't want to mislead somebody that you're just like one supplement away or one probiotic away from solving my problem. You got to dig to why it's there in the first place. Just saw an article, really interesting, that came out about these tighter slacks that gals are wearing more today, these yoga pant type things. They did a study and they found the chemical that was in them is such a high concentration of hormone disruption chemical. And this is right near your vaginal tract that you're wearing these tight pants. And then you could think, well, that makes me think about underwear. That makes me think about other things that I'm putting on my body. The creams, lotions, all this kind of stuff has chemicals in it that is hormone, not only hormone disruptor, what is that doing to my body? What is that causing an immune reaction in my body? Major issues. Those are the things that you want to dig in with recurrent infections of any kind. What are the best cellular detox supplements? Part 4 of this question. Well, I think when you talk about cellular detox, you're talking about what I call phase 0 detoxification pathway. So, and I list this out in my 7 phases of detox book, and my 7 phases of detox video, and my 7 phases of detox course. And I don't want to be just thinking I'm trying to upsell you guys on everything, but there's a lot of information in these courses, and there's a lot of information that we need to know about the physiology of a question like this. So I'm going to try to go quickly on this. So you have really 7 phases of detoxification, meaning let's start with the end, okay? And the end is you depositing things in the toilet. I call that phase 6. If you're constipated, or you're not having good bowel movements, you have no business trying to detox cellularly until you get that cleared up. And then phase 5 is what is your intestinal rate of elimination? What is your elimination rate? Meaning, if I eat corn today, do I see it in my stool tomorrow? If it takes 3 days to see it in my stool, my intestinal transit time is extremely slow. If I have intestinal transit time that's slow, even though I might have daily bowel movements, I'm reabsorbing a lot of poisons in my intestinal tract, particularly the large intestine. If I'm reabsorbing my poisons in the large intestine, because my intestinal transit time is slow, I'm defeating the purpose of everything as far as detoxification. So I have to make sure my intestinal transit time is healthy. So I'm not eating and have to run to the bathroom and have diarrhea, but I'm eating and I'm noticing what I ate that is indigestible, an indigestible starch or fiber that I ate in the toilet, in my feces the next day. I should have that. That should be the intestinal transit time, the rate of what's going through my gut. That I call phase 5. So if I'm reabsorbing poisons in my gut, then I need to deal with that before I have any business of trying to pull stuff out of my tissues. And then the phase 4 is how is the health of my gallbladder itself? So my gallbladder itself, we could even include my pancreas health in that. How is the health of that? Is that sluggish? If that's sluggish, I need to deal with that. So again, I go into greater detail in my book and on my course, my detox course on this. And then phase 3, 2, and 1 is in the liver. That's what you'd read about in your physiology book if you remember biology, human biology, if you've taken a course in that. You'll read a phase 1, 2, and 3 that takes place in the liver. So blood goes through the liver, and then through phase 1 detoxification pathway, it pulls toxins out of the blood, and it goes through phase 1, then phase 2, phase 3 gets bound to bile, it goes into the gallbladder, that's phase 4, and into the small intestine. In phase 5, hopefully you're not reabsorbing anything. In phase 6, you're deposited into the toilet. So how does it get into the blood? Well, it gets into the blood first by you consuming it, or you breathing in a toxin that goes directly into the blood. Hopefully it's going to get filtered right out of the liver. The problem is that you have congestion in the liver, slow phase 1, 2, 3 pathways, overwhelmed phase 1, 2, 3 pathways, so it circulates again, then finally will get dumped into the tissue, and then commonly gets absorbed into a fat cell, into your cells. It can go into any cell, but fat cells, I always say, have the spiritual gift of accommodation. They welcome anybody in. They take in a lot of toxins, but it can go into any cells. And then toxins can cause damage to the nucleus, and damage to the nucleus can cancer. That's what cancer is nucleus replication rate, replicating cells. That's cancer. Have to make sure our the thought is, well, goodness sakes, out of my cells, that all that phase zero, how you would use stuff out of your cells, you'd use chelators. So chelators, PTA, DMSO, there's a lot of different but you have no business doing that if you're phase 2, phase 3 in the liver, because it'll just get dumped somewhere else. So when you're healing the gut, you from the top down. When you're much slower than I did right here, and that's how you would eventually then pull stuff out of Next question. Hi, my 71-year-old husband had 2 sticks put in his heart day, aspirin, 81 milligrams, and another medication. However, this makes him have bruises and bleed easily, especially after showering and even before taking any blood thinners. He seemed to easily bruise and bleed. One concern also is that in the past he has had high H. pylori levels and ulcers, and as it is in his digestion and as his digestion is a bit delicate, so would there be any advice on how to counteract any possible internal bleeding or ill effects of bleeding elsewhere? Well, you have to follow the prescribing doctor's recommendations as far as that medication. I can't legally tell you to do anything differently with the medication, but the doctor should be able to run some tests to see, what his need is for that and how long he needs to be on that. And he should be addressing these other comorbidities. Now, you cannot be taking things also supplement wise that are also blood thinners. So be careful of that. And unfortunately, one of a good supplement to help kill H. pylori in your gut is garlic. And garlic is probably the number one supplemental blood thinner. So you cannot be taking garlic if you're taking blood thinners and you're already having bleeding issues. As far as trying to heal a bleeding ulcer, that's totally different. You shouldn't really be trying to kill H. pylori with, like I said, anything that's going to thin blood. Berberine is another great killer of H. pylori, but one thing to help heal a bleeding ulcer can be, there's different products out there. We have a product called Clear GI. It's got slippery elm. It's got, a lot of different herbs, okra and glutamine to help heal the gut. So there's a lot of good gut healing products out there. As long as he doesn't have cancer, you can definitely go on a product like that. So you do want to help heal any bleeding ulcer. You do want to also look for discoloration of any stools, because that will be a sign of a bleeding, an internal bleed. And your doctor should be informed. The doctor who has prescribed this should be informed of exactly all of the morbidities so that they can properly manage the medication. Okay, I want to become a professional in the field of naturopathic medicine. Where do I start? Good question. I want to become a professional in that too. That sounds fun. Sorry. Okay, so where would you start? Well, it depends on what you want to do. So, if you want to do chiropractic, then you just got to go to chiropractic school. If you want to be a naturopath that can be licensed in certain states, then you have to go to a 4-year naturopathic school. There are a lot of online courses for naturopathic information and for learning how to take care of people. There's pros and cons to that. So, on these holistic health hours and on some of my videos, I've shared some of my distaste uh, struggles that I have on where, I'm not on social media all that much, but lots of times when I'm on, I'll see videos of quote unquote naturopaths or some of them are even doctors. So it's even some people that are even doctors that are sharing advice, natural advice that I don't think is right. And so that kind of bothers me sometimes. Like, okay, I don't. Is this person is not saying he's a doctor or she's a doctor, but they're into natural healing. I don't know. Maybe they're selling natural products. I'm not judging, their education, but when they're sharing things that are wrong, that's you got to be careful of that. So I don't know. I just feel like there's huge benefit to learning, physiology and anatomy. So um, before you start learning, um, you know, some natural healing methods, because and I don't, and there's a balance there too. So just taking some online naturopathic type things can be beneficial because you could help a lot of people and you could help yourself. So I'm not saying that there's anything wrong with that, but you do have to temper your education with um, constantly learning physiology, because a lot of things that I see on videos are like, well, okay, one big thing that one of the naturopathic schools teach is that you need to alkalize yourself, and there's books written there's books written on these subjects that are totally physiologically wrong, and that bothers the daylights out of me sometimes because people get led down a pathway that's just incorrect. I mean, that's big in the cancer realm. So you need to alkalize yourself. Cancer can't grow in an alkaline environment. How many times have you heard that in the natural realm? These are just they're not true. Cancer, yes, it is a highly metabolic state where your cells are in rapid replication, as I shared, and it's going to spew out a lot of waste in doing so, and that's going to be acidic, and it can be kind of a slime layer around a growing cancer. And you do want to alkalize that and get in that and break that up. But you can't alkalize that by drinking alkaline water. Goodness sakes, there's even alkaline water machines. There's alkaline water on the market. You could go in a fancy grocery store and probably buy alkaline water. People pay exorbitant prices for this stuff to drink, pH of 9 water. Let's just think about that from a physiological perspective. It makes no sense. Your stomach is supposed to have a pH of about 2, and you're putting high alkaline water in there. What's going to happen? You think that alkaline water is now going to go into your small intestine still with a pH of 9, and it's going to be absorbed as water with a high pH? It doesn't even make any sense physiologically. How do you alkalize something in the first place? Put a bunch of minerals in it. Now it's alkaline. Well, that's great. What's the stomach have to do with that? The stomach has to acidify it. So you're having to acidify that alkaline substance that's coming into your body. Well, your stomach does that all the time. Hopefully, if you have proper amount of HCl produced by the stomach cells, then you're going to acidify that. But you've actually done no good by drinking alkaline water to think, but you're drinking alkaline water is going to alkalize your breast cancer. It makes no physiological sense. And I'm trying to teach people through my courses to start thinking, to start understanding some basic physiology so that you can think through this and go, that's not right. And if you could get your little physiology spidey senses up to catch these things, you're going to be better off for that. Do the people that sell this stuff know it's a scam? I don't know. Maybe they totally believe it. And I know there's people out there maybe listening right now and saying, no way, I was helped when I started drinking my alkalized water. It's probably because you started drinking more water. I don't know. I don't know. But I know that it wasn't because of the alkalinity of the substance you were drinking. So how do you alkalize the body? Well, first of all, that's not what your purpose is to do, is to alkalize the body. Your purpose is to eat good food, to make sure that you're low in the inflammatory scale, to investigate whether food that you are eating, you already have antibodies, you don't already have antibodies against, that's causing inflammation, even if it's good food. And you're trying to heal, what you have needs to heal. So it's just, so how did I get off on that? We talk about what education I should seek. Because you can learn a lot of these things from, schools that are out there, but there's a lot of bad information too. It's hard to direct you in the right direction. If you're wanting to go through college and spend a whole bunch of money and go through a good naturopathic college, that's your best bet. It's going to take a lot longer. You're looking at 8 years of education. You're looking at hundreds of thousands of dollars of education. That's going to be your best bet. But there's online naturopathic, courses that you can take for a couple $1,000s, as long as you're willing to really dig and study and learn physiology and learn human anatomy. I think you can learn a lot of this on your own. So it's just how invested you're going to be in really being good at what you do. And I think that's the key. Honestly, I've known a lot of doctors, and I've taught a lot of doctors too over the years that, a lot of times they're just there to make money, and it's like they're not really invested in really studying and really knowing this stuff. So it depends on you and your heart, really, because I guess you could spend several $100,000 in 8 years of education to just be as kind of a subpar doctor too. So it really depends on you and how willing you are to dig into this. I don't have another life. I don't play golf. I don't do anything else. I garden and I study. That's about it. I'm not a very fun person to be around. But, I think you have to be dedicated to what God has called you to. I believe this is my calling. I don't do this because I like it. Because half the time I don't. It's because I feel like I'm called to it. So you just keep studying and you try to keep learning, and you get good mentors. Next question. Can using the rife for cancer cause an increase in inflammation while it works to fight the cancer? That is a good question. I'm going to pull up this tab real quick because see if any other questions came in. So, can using the rife cause for cancer increase inflammation while it works to fight the cancer? Yes, it can. So using the rife is using frequency technology through light waves to stimulate the body to fight this cancer. Well, what part of the body is fighting cancer? It's your immune system. And your immune system does so by creating an acute inflammatory response. That's what your immune system does. So, I thought inflammation is bad. Well, yes, chronic inflammation is bad. That's a chronic inflammatory response with chronic cytokine upregulation. But you want an acute inflammatory response at the site of a cancer to kill the cancer, just like you want an acute inflammatory response when you have an acute bacterial infection or a viral infection. So it's not uncommon when a person is using a rife and it's programmed correctly for that person's cancer that around that cancer there can be inflammation. If there's inflammation elsewhere in the body, then that's an issue. You do want to look for possible antibodies. You want to look for possible autoimmune issues. But if there's just inflammation at the cancer, then that can be a good thing. I have a post on my website where I think a video is contained on it too, where I talk about cancer, good pain versus bad pain. Because a person, when you're fighting cancer, whether you're using a right or proper nutrition to fight cancer and you have an inflammatory response, depending on where that cancer is in your body, that increased inflammation could increase pain because it's going to occupy space. So look at that good pain, bad pain video on our website. Do symptoms seem to fluctuate when you are early on and using the right, using between better and worse? Yes, and that is a better sign if the symptoms are fluctuating, because your immune response isn't just constant. It will be a hyperimmune response killing things and it'll die off, and a hyperimmune response killing things and die off. It's not uncommon also to get a pseudo enlargement of a tumor when you're properly killing it as well. Meaning, even on an MRI, CT scan, or PET scan, it can look like it's an increased size because of the inflammation that's going on around the cancer, killing the cancer. So beware of that as well. Next question. 54 years old, have had herpes for 32 years, now constant outbreaks. In fact, 43 outbreaks since January 1st of this year. If I eat most any carb, even fruit, it can break me out. Of course, foods high in arginine, nuts and seeds and grains, can just eat one or two nuts and break out. So I avoid them as much as possible, but sometimes I crave them. I have done everything imaginable. Early on, I tried Zovirax and had terrible side effects. Since then, I've done lysine, peroxide, monolaurin, oregano oil supplement, parasite cleanses, long-term, consistent red heat lamp sauna, castor oil packs, coffee enemas, brain retraining, photon gene high frequencies, and on and on. I've had numerous labs. Was diagnosed with MCAS 2 years ago, in which I've uncovered mold, Lyme, strep, Epstein-Barr. Along with this, I've worked on gut, liver, got root canals taken out, you name it. Just can't imagine how to break the code. I know I am missing some labs that may help me. Any suggestions? Well, there's no way I can uncover that ball of wax on a platform like this. So we need to dig in. I mean, if you really want my help, you're going to have to do a case review, and we're going to have to kind of get going on a plan of attack of some different investigation. So when a person is hypersensitive to anything and it causes a flare somewhere else in their body, so in this case, it's causing a herpes flare. So herpes is a virus that lives in the nerve ganglions. So, for instance, herpes in your mouth, it lives in the trigeminal nerve ganglion. That's a ganglion of nerves right up here from cranial nerve 5. And then that will come out in your mouth when there's an opportunistic time. Usually with herpes in the mouth, it has to do with the pH change in your mouth. You suck on a lemon and you get a cold sore. How often do people end up with that? So it's because that drastically changed the pH in the mouth, and then the immune response went down, and the virus just migrated right down the nerve pathway and erupted in the lip or wherever. Same thing with genital herpes. It's a virus that you really, and a lot of these viruses, you can never kill them. You can't kill them. There's no immune magic. There's no right frequencies that could completely kill them, because there's debate whether they're even living organisms, right? So you have to learn how to manage them. So with management of that, you got to find the different triggers. So you think, well, it's that food that's the trigger. That's the trigger. Well, even if you know, okay, it's that food that triggers it, it can be an underlying core trigger. So it's some inflammation that's going on in the gut that you're at this hyper response, meaning that you're right below threshold. So anything is just constantly just tipping you over. So you have to figure out what are some other core triggers that are keeping your immune system at that hyper response just below threshold. So I'm not always getting an outbreak, but then anything just sets me off. Anything just tips me over. So you got to figure those things out and clean those things out. It can be complicated and it is a mess. And I understand it is extremely frustrating, but you can't give up on yourself. You just got to keep digging. Next question. Dear Dr. Cutters, we're looking for stomach ulcer help. The cause of this could be because of recently added medications. Can hydrochloric acid with meals have an adverse effect and cause pain? Any thoughts if using castor oil pack over stomach can be helpful, and other tips? Okay, so if you take HCl and it causes pain, that's a real good chance. So if you're not tolerant to HCl because of pain, real good chance you already have stomach damage or you have an ulcer. You have an active ulcer. You have to back off and go to acetic acid, so taking apple cider vinegar. You need to acidify the stomach because it's the lack of acid in the stomach that has caused the ulcer. Because remember, ulcers are caused from H. pylori, Helicobacter pylori. And Helicobacter pylori is caused because of decreased stomach acid 9 times out of 10. So if you had proper stomach acid in the first place, never would have got H. pylori, never would have got a stomach ulcer. So you got to back up and do that. But going right to HCl causing irritation, you may have to heal the stomach first. Go to our website, Conners Clinic, CONNERS, clinic.com, search H. pylori or Helicobacter pylori. I have a whole sequence of events and videos on how to do this correctly. If you have adverse reaction to HCl, you start with apple cider vinegar. If you can't even tolerate apple cider vinegar, you got to heal the stomach in the first place. And you could use things like we talked about before, deglycerized licorice. You could use okra. You could use glutamine. You could use so we have a product called Clear GI that can be helpful. It's a powdered form. You got to heal the stomach. You got to take a few weeks to heal the stomach, or it's not always the stomach, it's the duodenum too. You could have ulceration even in the small intestine elsewhere. So you got to heal the gut. And then you keep trying tolerance to apple cider vinegar until you could tolerate that with a meal. And then you add, and you're tolerating just fine, a couple tablespoons of apple cider vinegar prior to meal. Then you try HCl, and you have to up the doses of HCl. And I share a video on how to do that. So that will help you walk through that pathway to try to heal your gut, rebalance your hydrochloric acid production in your stomach, and to eventually work on killing H. pylori using, we have a product called ParaClear. We have berberine products out there that can be extremely helpful to kill H. pylori. Remember, with H. pylori infections, it is the #1 bacterial infection worldwide, according to the World Health Organization, and it is highly contagious. I mean, you'll spread it easily. So if somebody in your family has H. pylori, most likely you do too. So what's best is, when I have patients that have H. pylori, I say it's best that everybody in the family takes berberine or our ParaClear product. Maybe they don't have to take the same dosage as you do, but it's something good to take. I personally take berberine all the time. I take ParaClear, not every day, but at least once a week, because H. pylori is just everywhere. And H. pylori, we said it causes stomach ulcers and issues, but it is also the #1 cause of stomach cancer worldwide. And it goes systemic. It is the cause of rosacea. It's the cause of a lot of skin rashes that go undiagnosed. It's the cause of It's one of the top 4 causes of coronary heart disease. So H. pylori gets under the endothelial layer that's the single layer of epithelial cells that coat the inside of your arteries. It gets underneath that endothelial layer and can attack the smooth muscles. It can be the major player of high blood pressure. And it is definitely a major player in etching of the arteries along with homocysteine, and causes cholesterol patching. So cholesterol gets be named the bad guy, but it's actually H. pylori that is commonly a root cause, and we need to address that. I'm wondering if, next question, wondering if deglycerized licorice, DGL, is okay to take while on PPIs. So PPI is a protein pump inhibitor. If you're on a PPI, pretty much guaranteed you have H. pylori. So why did you go on a PPI? Well, because I had reflux and all sorts of reflux, and my doctor said that I should just go on a PPI because I could get esophageal etching, and I could end up with esophageal cancer. Tell you, PPI is like poison. I'm sorry. There's some drugs that are like, you could be on the rest of your life and it's probably going to have no ill effects. Being on Synthroid or something like that. Really, if you tolerate it well, you're not going to have any issues with that ever. It's a good drug. Being on a PPI is a bad drug. Never was a good drug. It was. You realize even to this day, it was only supposed to be used for like 21 days, I think, maximum. But people have PPIs for years. Horrible for you. You want to end up with, you could be on a PPI for just a short period of time and you're going to end up with H. pylori. Or more realistically, because you went on a PPI, it was because you had a decreased HCl and quite possibly H. pylori. So I can't legally tell you to go off a PPI. You need to deal with that with your prescribing doctor, but you need to deal with the reason why. This is another thing that I hound in this course is, you just give a person the drug to take care of the symptoms. It's just, to me, that's not the practice of medicine. That is the practice of current medicine. That's not the practice of healthcare. We'll just give you this drug to make the symptoms go away. Well, that'd be great. That's like hitting your head with a hammer, and I'm going to give you an aspirin so the pain goes away, but you keep hitting your head with the hammer. Okay, that's kind of what's going on with this. So I hate to be mean, but I need to be sometimes. That's just wrong. And I don't want to be mean to the person who's taking the PPI. You don't know, but you need to learn. So, go to our website, look up our blogs for H. pylori, HCl. Look at the videos on that. I have a bunch of videos on our course on that as well. Okay, good talk. I think we're done with our questions for today. And remember to go to our Holistic Health Hour website, and you can post your questions right on there. You'll see a box, I think it's a blue box on that website where you can ask the question that will more assuredly get the question answered on this talk. Plus, each one of these Holistic Health Hours are nicely indexed on that website, so you could go in and see what you're looking for. Also, look at our website, connersclinic.com. We have well over 1,000 blog posts, and I highly recommend that you join our courses. Goodness sakes, it's $50 for a course. That's too much money. You're not really invested in your healthcare. Sorry to shame you, but you need to learn this stuff, because if you don't learn this stuff, nobody else is going to teach you. HolisticHealthHour.com is that website, HolisticHealthHour.com. All right. See you next week.